Hi everyone, thank you for a lovely introduction. I'm Erika. I am one of the FEV nurses and I have my Master's in Behaviour as well and run my own behaviour company alongside the work that I do with Fife Exotics. What I'm really doing today, so it's a talk that I've kind of given before in a way to dog and cat people, and it'll be about managing stress in veterinary practice, but what I've said to the many students that have come across my path is that when we're working with exotics, we're kind of like, you're still dealing with an animal that's living and breathing and it's going to have the same stresses. So a lot of the stuff that I would have talked about for dog and cat is also applicable to exotics with, you know, just a few extra considerations that we might have to make, which is why I've called my talk Thinking Small today, because we'll be thinking about the fact that the animals that we're working with are a lot littler. There we go. So where are we today with low stress practice? If I have a show of hands of who maybe thinks that their low stress practice is excellent in their work. So I think, you know, when I first started nursing, I think we've come a really long way, especially with feline medicine. I think we're a lot better at working with cats in practice, but I think there's also a lot more that can be done. I'll kind of talk about some of the barriers to that as well, because there are a lot of actual barriers and a lot of perceived barriers to how we can reduce stress in practice. But at the moment, I would say we still got quite a long way to go, but I do think I'm seeing more understanding of how stressed animals can be and more compassion with the handling. So I would say we've kind of moved from, you know, scruffing cats. Does anybody scruff cat? You won't want to raise your hand. But I think, you know, when I first started, scruffing cats was pretty norm, and now that's really stopped and people are using more towel techniques. And, you know, things like, do people know what I mean when I say trancing rabbits? Did anyone? Yeah, people have encountered that. So where people would kind of hold rabbits upside down, and I really think that one, I've not seen that one in many years now. So I do think we're getting better. I think things like, has everyone heard of fear-free? Yeah. So fear-free, if you spend a bit of time with me, I'll get on my little stool about it and have a proper rant at you. I think fear-free is a great ideal. I don't think we're there yet, so that's why I like to call what I work as low stress. So I work in a way to minimize the stress as much as possible, or if I can't minimize the stress as much as possible, do what needs to be done quickly and then deal with the aftermath later. I've been talking to a few of you about this today, and I can answer questions kind of towards the end. So I think, yeah, as I said, we're doing okay, but we still do have quite a bit to go. So first off, I just want to talk to you very quickly about the fear response. So the fear response is identical physiologically across all species. So when an animal first encounters something that they are to be afraid of, they get a quick and intense state of arousal. So that's where, you know, if you hear somebody shouting, "Look out," in the park, and then it's that kind of jump that gets you paying attention. That's that sudden spike in adrenaline and all those big hormones. Chronic stress would lead to, then you'd have your cortisol coming in, and that can have its own problems. So this is more acute stress I'm talking about today, rather than chronic, which our exotics do suffer from as well. Fear response is also adaptive, which means that once we have learned from a fearful experience, we will remember that and we will become potentially more afraid or more vigilant of something like that happening again in the future. If you had something that maybe spiked your arousal levels and had you appraise the situation, so let's think of our zebra when they're at the watering hole and they see something moving in the bushes. You might see the younger ones in the herd kind of look up and maybe take a few steps away. So they'll do a little dash, but the older ones in the herd are like, "No, it's just a warthog, it's fine." So they've kind of adapted to the sights and sounds and smells, whereas the younger ones won't have, but they'll pick up from the rest of the group, if that makes sense. So that's how we can adapt it. And that's how we can also teach animals to not need to be afraid of things that have previously caused them fear. So there are emotional and physiological components. So I kind of spoke about the physiological ones where we're getting that spike in adrenaline to begin with, and then longer term chronic stress will get more cortisol and other hormones getting involved. But you do have, you'll know yourself that if you've had a scare of something, you will have that intense emotion linked to it sometimes. So I know for myself, it might be that a certain smell can take you, or a certain noise can take you to a thing that has stressed you out in the past. It's the same with our animals. So that's why they're going to get stressed. Those cats are going to get stressed when they see the carrier. Same with rabbits and our other exotic species. There'll be those little changes that they're like, oh, I remember this, and that wasn't fun. And when we talk about emotions, all of our animals are feeling emotions. So they may not be as complex as the emotions that we like to think of with humans or other kind of highly emotional species, but they will still be feeling those and probably hiding them. You've probably all heard of fight and flight. So those are the two that are most commonly used. So these are the 5 Fs are basically any species response to something that's scaring them. So fight and flight are your typical ones, but the one that we really see a lot in exotics is freeze. So that's where, you know, the animal will just stay still. That's a kind of protective mechanism for, or rather a protective mechanism against those animals that will chase and catch. So they're just trying to stay, you'll see a lot of our rabbits do this, so they just stay small and don't want to do anything at all. The other two, just for interest, are fiddle and foal. Not many people know about these two, but you'll see this in, so with the fiddle one, you know that spaniel that comes in and you can tell it's not chill, and the owner's probably thinking it's excited, but it's going around, it's sniffing at everything, and it just won't stop fidgeting, and you can't really do anything with it because it's just moving all the time. That's the fiddle response. So it's very stressed, it doesn't know what to do with itself, so it's trying to distract itself as much as it can. Tend not to see this one as much in exotics as with the foal one. So that is my dog does this as her stress response, but she just acts like an idiot. So she just throws herself around and barks and doesn't really know what to do with herself. But that's her way of relieving stress because she doesn't know how to cope in that situation. So I'd say the 3 main ones that you are going to see with exotics will be your fight, flight, and freeze. But it is cool to know, if you're a behavior nerd like me, it's cool to know about the other 2. And all our fear responses, they vary depending on what stimulus has scared them. So I'm going to have a different reaction to, for example, a spider in the corner of the room compared to a spider that just crawls across the desk, because it's a completely different intensity of that. And then we also add in frequency and duration to the amount of stress that can come. So that's where our kind of chronic stress will start to feed in. So chronic stress would be something I'd be starting to get worried about for a patient with long-term hospitalization, or one of your patients, for example, a rabbit with recurrent GI stasis, what's going on at home that is then bringing that into the stress that it's having in the vet practice, and is there some chronic stress going on? And lastly, your fear response is going to be impacted by the animal's perception of their ability to escape. So are they able to reduce the thing that they're scared of? Are they able to avoid it at all, or are they able to escape? So sometimes in vet practice we can provide a kind of something a bit similar to that. So that's where we might, for the rabbit, let it go back into its carrier while we do the rest of the consultation, because it's able to just reduce its own stress by kind of hiding and getting out of that scary situation. And then all our behavioural responses are also impacted by age, breed, health, previous learning, and their current environment and their home environment. So can I have a show of hands for dogs and cats who thinks they're really good at recognising fear in the species they work with? More confident than that, pals. Okay, so 83%, this is a study by Dawson and others in 2018, 83% of vet practitioners that were interviewed believed that they had a good relationship with a behaviourist or trainer, and 77% believed that they used appropriate methods to reduce or minimise fear. But when they were presented with exercises where they had to identify fear in dogs and cats, only 50% of practitioners could actually identify those signs. And again, that's dogs and cats, but I think let's just assume that all our exotics are feeling some level of fear in the vet practice as well. So I think that was quite an interesting one for me to come across. So it's just, there is a slight mismatch between our confidence levels and our actual ability. So it might be something to bear in mind when you're back in practice, and thinking like, can I really recognize this well enough? What am I doing to alleviate these kind of concerns? So fear in dogs and cats, it wouldn't be a presentation by me if I didn't have two of my own in there. So we've got Toki, my cat. I don't have any exotic pets at the moment. And then Rogue when she was a puppy, which is one of my dogs. So fear in dogs and cats, we tend to talk a lot about socialization. So that's the kind of early development stuff when they were very young. In exotics, again, all of these things are applicable to exotics, but socialization periods will be very vastly different depending on species. And some of the socialization periods, we won't actually know what they are. I couldn't tell you what they were for reptile species. I'm not sure that we have that data. We're going to have a difference in fear dependent on that patient's own individual history. So have they had a bad experience before? Have they had bad handling but at home, and then that comes into the vet practice, and now we've got a patient that we're really struggling with. They'll have previous learning, and they may have previous training, so you would be surprised how much training you can actually do with exotic species. I know one of our nurses, Monica's done loads of training with her own reptiles and other animals. You've seen in your tour today that the training that we've done with the animals out here. But then some owners you will have who have just got rabbit in a hutch, doesn't get handled, and it's left to itself. So it's good to get this history to understand a bit about what your patient's going through. And then we have to really think about the pre-existing pain or illness, because unless they're coming in for vaccinations, most of these animals will be in a fairly high level of stress because they're unwell, and they will likely have hidden being unwell for a long time. Rabbits definitely, they're a prey species, they hide being unwell. I've seen loads of chickens that have come in and have been on death's door, but it's only been noticed, in the last hour because they've just hid it so well from their owners. And, we'll have these fantastic owners who really do know their pets, but it's still difficult for us to get that understanding of what they're going through until they're really, really ill. A couple of other things in our exotics though is what species are they? So that will have an impact on how they are coping in the vet practice and how they're managing their own stress. We do have to think about whether they're predator or prey. I think this one touches with cats as well, because for me cats are quite interesting because they're both. We don't always think of them as both, but they're actually quite a small animal and they can be hunted if they're an outdoor, if they're outdoors, and that is part of their evolution. But so one of the things I think about a lot with exotics is when, if we think, for example, one of their predators, one of the animals that might be predating on them, could be raptors. So, and then we're coming with our hands and we're kind of doing almost that same motion as the things that are hunting them would. So we're accidentally doing there's these little human factors that we're doing completely by accident, completely because it's easy for us. But actually that's a really big indicator for that species that it's about to get eaten. So I think we need to be thinking about that. Patient size as well for handling, like sometimes the little friends are so hard to handle because we don't want to hurt them. And they're struggling and it's difficult because I'm thinking of chinchillas for some reason at the moment, but they can be really wriggly, but they're also really fragile. So we do need to be super careful with handling them. And that's why I use a lot of towel handling so that we're not gripping too much. And another human factor, something to make yourselves aware of, is when we get stressed as humans. So if we're going through a tough day at work and there's a lot going on and you really need to check this patient, you're really worried about it, we can accidentally grip too hard. So it's just remembering that, am I actually handling this am I making it a bit worse? Which you might be, and if you're struggling, I always say take that step back and just analyze what's going on with you internally first, and then we can go back to our patient. And then lastly, we need to think about what other stressful stimuli is going on. So for example, with birds, they have a different frame rate of vision than we do. So often with a lot of lights, they will see them flickering, where we see a solid constant running of the light, because their brain is processing that different. So with a lot of our birds, when they come into the clinic, it's like being under a strobe light. So that's why we would say kind of turn lights off, make it as dark as possible, make it as quiet as possible, because all of our different species are going to have different ways of hearing. They're going to have different light sensitivities, different scents are going to stress them out. So they're also going to be smelling, if they're a prey species, for example, they'll be smelling the dogs and cats and the things that will be hunting them. So think of your rodents coming into a room that might have just had terriers and cats in it all day. That's going to be really, really stressful for them as well. So just making sure that we're nice and clean and washing our hands between patients, and using a new towel for each patient. So usually for myself, each patient will have a different towel. And when animals are hospitalized, they'll typically have the same towel for use throughout their visit. So unless it gets soiled, they'll have that same towel that is the one that they get handled with. So it does have their smell on. And for me, I don't know if my other nurses actually fully agree with this, but I don't change their bed if it's not soiled, because it still smells of them. So I do that quite often with cats, when I haven't worked with cats in years now, but I used to do that quite often with cats. So if it wasn't directly soiled, they could keep the same bed, because it's got all their own pheromones and their own smell on there. So I already chatted about some of the human challenges that we come across, like gripping and things. I think with a lot of our smaller species, our exotic species, we have to think about historically how these species have been kept and treated. So I've seen this sometimes with, probably not with anyone here because you're here today, but is thinking about what were those animals used before. So, that I've heard some vets say in previous practices, it's just a chicken. So I think sometimes this stuff can lead into biases. It's just, this stuff can lead into biases and make us not really understand the animal that we're dealing with, and not fully comprehend the emotions it might be feeling. And with species like chickens or fish, there's a lot of kind of underestimation of the intelligence of these animals as well. So the whole goldfish only have a second memory is absolute. It's not. it's not true. They actually have they're really intelligent species. But we kind of have these little memories and these things that have gone on just because of historic stuff that we've been taught. Also, we often have I'm just rushing because I've been told I've only got 5 minutes left. We also will have sometimes different attitudes towards animals that are in our food chain. Our own little biases, sometimes our own lack of experience. We can be really stressed ourselves about handling a certain patient because we don't have the experience in that species. My big one for that is just remembering that they're still animals. Just think of them as a different shaped dog or cat. They will be stressed. The ways of reducing stress are the same as we'd use in a dog or cat. I'm very quickly going to talk about language use. So can I see a show of hands that anyone who has ever had an angry cat to deal with? Okay. So the use of the term angry cat actually leads you to handle that patient more roughly. So that's a big take home I'd like you to think of for all pets today, is what language am I using? So it was a study that I myself did with some other people as part of my master's project, but one thing we did was compare how people would handle an animal, whether we said stressed or angry. And when we said angry, people were much more likely to use forceful techniques. And when we said stressed, they were much more likely to use a towel, dim the lights, and have a much calmer approach. So I just wanted to throw that one in as let's stop calling them angry, let's start saying stressed, fearful, anxious, because it's a much more appropriate term to use, and it does actually impact our own behaviour. I do appreciate that we have a lot of time pressures. I have time pressure just now, I'm being looked at. but I will just skip to my what to do things. So one of the things I think is remember that spider. So when you're approaching something that's a little bit smaller, would you rather be approached by a spider that like came from the corner and then came towards you really nice and slowly, or that one that scuttles across my keyboard? So how can we make ourselves not scuttle across the keyboard at this patient? Remembering taking a breath, thinking about what's going on internally with yourself. So am I having a tough day? Is something upsetting me? What, is there loads of noisy stuff going on? What can we do? Have that empathy and see if we can remove those misconceptions. So identify those biases that could be like, oh, it's just a chicken. It is a thinking, living, breathing animal, and we need to minimize that stress as much as possible. And then doing reflective practice as well, which is a little CPD cheat that I'd like to leave you with today as well. So if you have a bad experience and you're able to chat with your colleagues for half an hour, you can log that as CPD. So that counts as your reflective practice. So I would encourage doing it. Anyway, sorry we kind of rushed towards the end there, but I hope that was informative. And I'd just like to open the floor to any questions. Oh, yeah. That is, that's one that I debate, so I have thought about a lot. There's not really any evidence about it. So, sorry, the question was whether I change the towel. If the animal's had a stressful experience, do I change the towel? Probably yes. So they probably let off a lot of stress, like their own pheromones that will be stressing them out. So you're probably best to then change that towel. But hopefully you still have something of their own in their kennel that they can go back to. Yeah. Mm-hmm. So the budgies are one where I would say do as much of the clinical exam as you can without touching the patient. And then when you do have to touch the patient, make it as quick and calm as possible. So having that plan in your head of, okay, I'm going to catch them really quickly, check their wings, check their legs, check, around their beak or in their mouth, and then put them back, let them chill, and observing for any like fast breathing or anything. And never be worried, unless it's super urgent, never be worried about saying no or like coming back another day. But some of these animals are the ones where let's plan as much as we possibly can and let's get it. This is why I'm not fully fear-free as well. And then let's get it checked as quickly as we can. And with your birds, I don't have any of the doses, but if you email us, I can get you response. But nasal midazolam works really nicely in birds to help with stress reduction. So it might be that's something that you're able to tie in. I've talked to a few people about my love of midazolam, but I'm going to be shoved off, so I don't have the time to talk. But you can always email us and I can tell you, yeah, it's great. Okay, thank you again.